Good morning and welcome to today's New York City Council hearing for the Committee on Health. At this time, we ask that you silence all electronic devices and at no time are you to approach the dais. If you'd like to sign up for in-person testimony or have any other questions throughout the hearing, please see one of the Sergeant-at-Arms. Chair Schulman, we're ready to begin.
Thank you. Good morning. I am Councilmember Lynn Schulman, Chair of the New York City Council's Committee on Health. Thank you all for joining us at today's hearing on introduction number 998, sponsored by Councilmember Keith Powers, which would codify the Cooling Center program. We will also be hearing Resolution 822, sponsored by myself, which would call on the New York State Legislature to pass and the Governor to sign the Fair Pricing Act, which would cap the cost of routine medical procedures at 150% of the cost paid by Medicare for the same services. Before we begin, I would like to recognize the following council members. Councilmember Keith Powers, and remotely we've been joined by Councilmember Marmorato and Councilmember Menon. As climate change accelerates, New York City will continue to face longer, more frequent and more intense heat waves. The science is clear. Extreme heat is the deadliest weather-related event we face, surpassing hurricanes and winter storms. According to the New York State Department of Environmental Conservation, urban areas like New York City are more susceptible to extreme heat because of the heat island effect, where heat-absorbing surfaces like roads and buildings elevate temperatures to deadly levels. The heat island effect increases the risk of heat-related illnesses and deaths, especially among vulnerable populations, including older adults and people with disabilities. In fact, the city's built environment is making temperatures almost 10 degrees hotter for the average resident than they would be otherwise, according to a study by the nonprofit Climate Central. According to DOHMH's most recent heat mortality report, extreme heat events led to 570 premature deaths in New York City in 2024 from heat-preventable illnesses, a significant increase from the number initially reported, which was 340. The impact of extreme heat is not felt equally. Certain neighborhoods in our city, many of them historically underserved communities, are at the highest risk and experience disproportionate heat exposure due to limited tree cover, dense infrastructure, and higher poverty rates. Residents in these areas are more likely to suffer severe health consequences from extreme heat. Unfortunately, some of the boroughs with the greatest need also have the lowest number of cooling centers. My borough of Queens had the lowest number of cooling centers per 100,000 residents, according to a 2022 report from the New York City Comptroller. Per that same report, East Flatbush in Brooklyn was significantly underserved by cooling centers as well, with only 2 available for over 162,000 residents. That is completely unacceptable. Cooling centers are a lifeline, especially for our most vulnerable populations, older adults, low-income residents, and those with underlying health conditions. Yet gaps in cooling center accessibility mean that many New Yorkers remain at risk during dangerous heat waves. That is why introduction number 998 is so important. The bill has been around for numerous council sessions and has failed to cross the finish line as of yet, but that is going to change. Because of its longevity, there are aspects of the bill that need updating, but we will work to ensure that the final version includes everything necessary to codify a program that is such a vital lifeline for New Yorkers and their health. In closing, as extreme weather events become more frequent and deadlier to our health, it is more important than ever to ensure that every New Yorker can access affordable and quality health care. That is why I am proud to sponsor Resolution 822, which calls on the state to pass and the governor to sign the Fair Pricing Act, which would enact a neutral payment policy for routine medical services to ensure that New Yorkers are not charged arbitrarily high prices because of hospital market power. I want to conclude by thanking Councilmember Powers on his leadership with this bill, the administration for being here, as well as the dedicated organizations, advocates, and members of the public. I also want to thank my staff, as well as the committee staff, for their preparation for this hearing. I want to acknowledge that we've been joined by Councilmember Narcisse, and I will now pass the mic to Councilmember Powers to make a statement on introduction number 998.
Thank you. Let me find my remarks here. Thank you, Councilmember Schulman. I'm City Councilmember Keith Powers, here we go. Gotta get organized over here. I want to thank Councilmember Chair Schulman and committee staff for holding this hearing. I want to thank 43 colleagues in the City Council who signed on to support, a tremendous amount of support for this bill. I also want to recognize Councilmember Kalman Yeager, who had carried this bill in the past. As we know as New Yorkers, extreme heat is a serious public health threat. It's the leading cause of weather-related deaths in the United States and the cause of approximately 580 deaths in New York City last year, according to the city's annual heat-related mortality report. As we know, climate change will not only make summertime heat waves hotter and more common. While New York City has been proactive in taking measures to reduce the impact of climate change, we also must be prepared for these worst events. Studies have indicated by the end of the century, thousands of New Yorkers may be at risk of losing their lives each year due to extreme heat. So we must be doing more to protect our neighbors. During the week-long heat wave in July of 2022, some communities were severely underserved by cooling centers. For example, one especially heat-vulnerable neighborhood in Brooklyn only had 2 cooling centers to serve over 160,000 residents. Even when cooling centers are open, they're not always accessible to everyone. They can be closed on weekends or in the evenings. And senior centers, which serve one portion of the population, counted for almost half of the city's cooling centers in July of 2022, or at least advertised as serving one portion of the population. My bill brings much needed improvements to the city's approach to cooling centers and codifies a program that is here to stay. Legislation makes sure there's a reasonable baseline for the number of cooling centers during heat-related emergencies and prioritizes an equitable distribution of these services. It also ensures that information about cooling centers, including locations and hours of operations, is available to New Yorkers year-round. It also mandates a public education campaign and focused data gathering efforts, 2 important steps in further preparing the city for future emergencies. In the face of budget cuts or instability, it's important we enshrine this program into law so New Yorkers can rest assured that no matter how hot our summers get, there will be a permanent, reliable cooling center program available to reduce risk and save lives. By passing this bill, we can expand access to these cooling centers and save lives in the most vulnerable communities. It's just that simple. So thanks again to Chair Shulman for holding this hearing and to my fellow sponsors, committee staff, and advocates for their support. I look forward to hearing the testimony today and moving this legislation forward.
Thank you, Councilmember Powers. I will now pass the mic to the committee counsel to administer the oath to members of the administration.
Thank you, Chair. Good morning. If you could please both raise your right hand. In accordance with the rules of the council, I will now administer the oath to the representatives from the administration. Do you swear to tell the truth, the whole truth, and nothing but the truth, and to respond honestly to council member questions? You may proceed.
Good morning, Chairperson Shulman and members of the Committee on Health. I'm Christina Farrell, the First Deputy Commissioner at New York City Emergency Management. I am joined here this morning by my colleague, Carolyn Olson, from the Department of Health and Mental Hygiene. And as stated, we are here today to discuss Introduction 998, a bill to codify the city's cooling center program. Emergency management with Department of Health and other agencies maintains plans and protocols to guide New York City's response to heat emergencies, including plans for cooling the public, messaging, and providing guidance to individuals, agencies, and the private sector on suggested actions for the public to remain safe during periods of extreme heat. When the city's heat emergency plan is activated, extensive messaging is disseminated through citywide channels, including press releases, city agency websites, Notify NYC, the New York City Advanced Warning System, 311, elected officials, community partners, and social media channels. Cooling center facilities are not operated by our agency, but are managed by public and private sector agency partners, each with their own hours of operation and differing levels of accessibility. Cooling centers are air-conditioned spaces such as older adult centers, community centers, public libraries, and other facilities that typically operate during daytime hours and are free and open to the public. Cooling centers that are available for public use are listed on the city's Cool Options Finder, a 24/7, 365 online tool where New Yorkers can see open options during a heat emergency. New Yorkers may also call 311 for this information. The Cooling Center program is only one of the ways emergency management addresses extreme heat. In 2024, our agency revised our heat emergency plan to emphasize additional cool options and updated the Cool Options Finder to ensure year-round accessibility. New York City Emergency Management has expanded its partnership to offer more cooling centers, including cultural sites and elected officials' offices. We are also focused on our approach on where to tell New Yorkers to go on hot days, which can include many options throughout the city, including friends and family, museums, commercial facilities, and pools. On heat emergency days, the city ensures that our partner sites are available as cooling centers, a type of cool option. We are grateful to the 4 city council members who have agreed to have their offices identified as a cooling center and added to the finder, and we hope that other elected officials will do so this year. This legislation, as relates to cooling centers for heat emergencies, is largely already in action. There are a few details, as noted, that we would like to discuss further with the council, such as updating definitions to be consistent with those used in our plans, and discussing the survey component, which comes with a significant cost, yet we believe would not yield actionable results. Further, in 2020, the New York City Council passed Local Law 85, which codified the cooling center program under Emergency Management's Administrative Code with the requirement that the agency submit an annual report to council detailing various components as well as publishing it on our website. This report, which we are in compliance with each year, is largely duplicative to the reporting requirements detailed in this legislation. However, we have significant concerns about the tying of air quality indices into the cooling center program. As my colleague at the New York City Health Department will testify, pushing people to leave their homes to go to clean air centers poses health challenges that may outweigh any potential benefits, as the impact and effectiveness of clean air centers has not been tested. To provide some further context here, and as we testified in the 2023 air quality hearings, forecasting air quality indices, especially for smoke, is incredibly difficult and complex because forecasts are issued by the State Department of Environmental Conservation on the day of. Air quality can change rapidly. Predicting if air quality will improve or worsen can be difficult because of the unpredictable behavior of wildfires and factors such as wind, weather, and terrain. The city does not get an official notification on air quality. Instead, the New York City Health Department monitors the air quality index daily and will issue a health advisory if there is a potential for New Yorkers to be affected by poor air quality. Emergency Management then pushes that messaging out through Notify NYC and other channels. As noted above, the city does not operate cooling centers, but rather we rely on our partners. These partners commit to provide air conditioning spaces with seating and water. Asking them to verify that the air is clean within their facilities is scientifically fraught and comes at significant cost. The estimated cost for the legislation at hand starts at least $260 million for initial retrofit and increases each year in perpetuity to maintain the clean air standard. This cost reflects the science that most air quality alerts that New York City Emergency Management amplifies are due to high ozone rather than smoke. Traditional air conditioners and HVAC systems do not filter ozone nor fit the standard, and facilities would have to be retrofitted. Even LEED certified buildings such as New York City Emergency Management headquarters do not fit the standards being asked. We have had conversations with our West Coast partners, including LA, Seattle, and San Francisco, who have been candid about the different models they have tried to address their air quality issues. They generally work with nonprofit and community centers and have received funding through grants and state boards, yet have not seen high demand for these centers. We will continue to speak with them and learn from their best practices. However, as the Council also knows, there is a growing and concerning unreliability of federal funding. For example, recently the Federal Environmental Protection Agency announced plans to cut hundreds of grants of more than $1.7 billion. We rely on the EPA for air quality monitoring and guidance, and as a base level, are now unsure about the future of air quality monitoring in general. Requiring partner organizations to open for high air quality indices would entail significant changes to how the cooling center program currently operates as an effective and successful program to provide cool options to those vulnerable to heat emergencies, thereby diluting the effectiveness of our extreme heat messaging and potentially causing our critical partners to balk at continuing their partnership. Add to that the fact that cooling centers open for a very real and scientifically backed health reason related to heat exposure, but there is no scientific backing that the same measures for air quality exposure further dilutes the effectiveness of our messaging. We ask the council not to tie clean air centers to cooling centers, as they do not provide relief from air quality changes. Air quality is something that we have long monitored and built into our response procedures. We worked with our agency partners and City Hall to develop the New York City Air Quality Emergency Guide in late 2023 and have socialized this with training and seminars for our partners. We have masks available at police precincts, libraries, and for elected officials who request them, as Council Member Schulman is aware, having taken us up on this offer and provided masks to hand out to her vulnerable constituents. Having a menu of options that can be used for a wide range of incidents and hazards is essential, especially during air quality alert emergencies, because of the challenges in predicting smoke concentrations. Cooling centers are a response to extreme heat. They are not a one-size-fits-all solution. Opening them during times of poor air quality provides a cool space, but not necessarily one with better air. We urge the council to let scientific findings guide the programming that our communities require. Thank you for this opportunity to testify. I will now pass it along to my colleague from the Health Department.
Great, thank you. Good morning, Chair Schulman and members of the Health Committee. I am Carolyn Olson, Assistant Commissioner for Environmental Surveillance and Policy at the New York City Department of Health and Mental Hygiene. On behalf of Acting Commissioner Morse, thank you for the opportunity to join my colleague from New York City Emergency Management to testify today on this legislation concerning cooling centers. Extreme heat events are, on average, the most dangerous type of extreme weather, killing hundreds of New Yorkers every year. As described by First Deputy Commissioner Farrell, the city activates the heat emergency plan by relying on the National Weather Service's science-based advisories issued based on their highly specialized forecasted heat index. Advisories recommend that people most vulnerable to heat impacts use their home air conditioner if they have one, or if not, that they go to an air-conditioned place, such as a cooling center, shopping center, or the home of a friend. These advisories also urge the public and service providers to check on people who are vulnerable to heat-related health impacts, especially those without residential air conditioning, who have a chronic physical or mental health problem, or are elderly. There are several reasons that cooling centers are an important component of the city's multi-pronged response to heat emergencies. First, health risks from extreme heat are significant. While seasonal hot weather contributes to heat stress when the heat index reaches about 95 degrees and above, the risk of serious illness or death increases rapidly. Second, heat stress is cumulative. Consecutive days of extreme heat compound the risk as the body's temperature rises and dehydration worsens. Third, our epidemiologic research has shown that lack of air conditioning at home during extreme heat is the strongest risk factor for heat stroke death. About 90% of adult New Yorkers have home air conditioning, and about 75% of vulnerable adults report using home air conditioning often during extreme heat. But about 80% of the victims of lethal heat stroke die at home, almost always without working residential cooling. For all these reasons, cooling centers are a key part of an extreme heat public health protection strategy. I will now turn to the legislation's proposal to open cooling centers on days with air quality health advisories, regardless of the forecasted heat index. The Health Department concurs with NYSEM in our appreciation for the intent behind this proposal, as well as our concerns with its implementation and potential impacts. While well-intentioned, this proposal is unlikely to reduce pollution exposure and could have the opposite effect, increasing it in some cases, while placing a heavy financial burden on the city. When there is extreme heat, cooling centers definitely lower people's heat exposure because of air conditioning, which allows for recovery from heat stress. As little as a few hours in a cool environment can decrease a person's risk of poor health outcomes due to heat. In contrast, any indoor location during an air quality event will reduce a person's exposure to air pollution, so we tell New Yorkers to limit their time outdoors as much as possible. When the air quality is poor, a person's short-term exposure to pollution could be increased by any time spent traveling outdoors, including a visit to a cooling center. In addition, it is much harder to ensure that a cooling center's air quality is any better than a person's home. In the center they visit may have a poorly designed ventilation or be in a more polluted location than their home or workplace, like near a high-traffic road. After the air quality event from wildfire smoke in 2023, the city developed a detailed emergency response protocol for any similar events. An important component of this preparation was the development of clear, evidence-based health messaging for New Yorkers based on the EPA's Air Quality Index, or AQI. The Health Department provides guidance for the general public and for childcare and school settings on our website for air quality events. The primary message we want to deliver is that short-term ambient air pollution exposure is driven by two main factors: the amount of time spent outside and the level of people's activity when they are outdoors. During lower level advisories for people who are sensitive to air pollution, we do not advise changes in behavior for the general public. Once the AQI reaches 150, it can be unhealthy for anyone, and our messaging focuses on staying indoors and limiting any strenuous activity outside. Opening public cooling centers as clean air centers would conflict with the clear evidence-based messaging to stay home. Lastly, the health effects from short-term air pollution exposure increase gradually, in contrast to the rapid rise in illness and death associated with extreme heat. The best way to protect vulnerable New Yorkers from air pollution will be to continue to implement programs to reduce levels of air pollution in the city and thereby decrease the chronic exposures that have the greatest impact on health. Thank you for the opportunity to testify. First Deputy Commissioner Farrell and I would be happy to take questions.
Thank you. I'm going to actually ask Councilmember Powers to ask his questions first because he needs to leave. So, Councilmember Powers?
Thank you. Thanks for the testimony. A lot of time, I understand the concern about air quality and the part of it, but like an inordinate amount of time spent on that. So I want to just talk about the cooling center piece of it, and then we can talk about the air quality piece of it. The bill, at the heart of the bill, is to codify cooling centers here. Yes, there's the air quality piece of it too. We can debate and discuss that. But on this, as a standalone, codifying the cooling centers in the bill as we're trying to do. Could you just give me your feedback on that piece of the bill, separate, setting aside the air quality piece of it?
Sure. We've been doing the cooling center program in the summers since the late 90s. And it is, one of our standard programs. As everyone has said here, we know that people are vulnerable. We have fantastic partners, all of the libraries, the older adult centers, community centers, new partners that we've brought in. And so we stand by that program. We are very proud that, last year at the beginning of the season, we had over 600 facilities that were signed up. Obviously, not every facility is open every day, but by contrast, in the city of Chicago, they opened 6 cooling centers across the city when we're opening hundreds. As we said in 2020, the extensive legislation was passed. We now put a plan on our website. We update it every year. We have, over the last couple of years, been able to change the cooling center finder from a just-in-time application to something that is 24/7. So even today, when it's cold out, people can go on and they can look and plan if they want for the summer. We feel like a lot of what is covered in the bill is already covered by our daily operations and by the 2020 legislation. But for the cooling center part of the bill, we don't have any serious roadblocks.
Okay, thank you for that. Are there any plans at this moment to expand the amount of cooling centers that the city has? I think you said about 600 right now. Is there any plans? There's been controller and others have done reports indicating at certain communities that were maybe the most vulnerable did not have adequate access or enough access. So what are plans in the coming year to, what is the expected number? Are there plans to expand?
So we have been expanding every year. As we noted last year, we were able to add several cultural sites. I believe the Museum of the City of New York, the Brooklyn Museum, some others, which is fantastic. We also, for council members, opened, other elected officials had opened up their offices. We are always looking for new partners. You know, as one thing we have found is that there are what we call traditional cooling centers, non-traditional cooling centers. During COVID and last year, because several of the hottest days, one was Juneteenth, which was a federal holiday and a city holiday, and several were on Sundays, when understandably many locations are not open. So we have worked with other partners, for example, New York City Public Schools, at expense to them last year. Nobody receives any type of funding to run the program, to be a center, to pay for the air conditioning. You know, there's no funding with this program. Schools did open last year. They, on average, saw less than 5 people total for the 20 schools. So most of the locations that opened last year on those Sundays did not have any people visit, and that was borne out during COVID as well. You know, I think that people are used to going to libraries. Seniors are, you know, enjoy their older adult centers. They have a community there. They may get food. They may do other activities. And so, you know, people really go where they feel comfortable, where they know how to get there. They, you know, are just going to have them. They're not just going to sit there, basically. And so, you know, we are looking, that's why cultural institutions are a really good option to the extent they're able to participate. And, you know, outside of just the cooling centers, like we said, there are a lot of cool options. You know, there may be malls, there could be other locations, and so we're noting all of that on our website. But we are always, and over the years, I've been in emergency management a long time. Over the years, especially years, you know, during COVID or other, when we didn't have as many sites open, we've asked people, we have a Share Your Space survey where people can note that they would be interested. Specific elected officials or community groups have sent us information. We've followed up with them, and so we are, as long as people can give us the basic things we need, we're happy to add them. But we don't have the power, the authority, or the funding to compel any organization to be a cooling center. Okay. I will also say, just looking at the comptroller's report from a few years ago, that I believe was based on community boards, and so I think we all know you can live on the edge of one community board,
for sure,
and you know, but go to things next door. So I mean, I think they needed a way to look at their analysis, but you could have something in another community board that's closer than the one closer to you. So we, you know, we didn't really agree with all the findings in that report.
I got it. I believe the Department of Health had updated their report from last year about individuals that had died related to heat. It originally was 350. I believe the number is now up to 580. Can you talk about why that number got updated? What was the cause for that number to go from 350 to 580, and the discrepancy, and just talk us through that number change?
Definitely, thanks for that. So we discovered an error, quite literally a typo, in our estimation of heat-exacerbated deaths. So this is an analysis that requires the application of a risk estimate, which we didn't have any errors in, to the number of deaths that occurred in the city. And we are then able to estimate the number of people who have had a condition that is exacerbated by the heat. And so when we identified this error, we immediately corrected it. And what we discovered was that previously our estimate was approximately 350 deaths per year, and that number is closer to, it's more than 500. So in our most recent 5-year period, because we estimate for 5 years at a time, we see that it's about 580, as you said.
For last year?
No, so I want to be clear that this doesn't represent an increase from last year. This just was literally an error, and so the last 2 years, which both took, we do rolling 5-year averages, so we add a new year, right, each year, and both of those were around 580, more than 500.
I see. And where did the typo occur?
It was literally in the code that we have, so, we discovered that we had a character that was wrong, and it was pulling in the incorrect data sets in order to calculate that specific number.
And have you guys gone back to look at previous years to see if the same error?
Yeah, so those reports include trend analyses, which we actually started producing last year. So this was the second year, so we corrected and updated the 2023 and 2024 reports. And in both of those reports, for the first time, we did trend analyses, and we've made certain that all of those analyses are providing the correct numbers.
And how did that get caught? Like what was the cause of going back to look at?
Oh, yeah. So we're constantly updating those analyses, and this is an annual report that is required by City Council. We've been doing for a number of years. So every year we work to expand our analyses and improve upon them. And we always have at least 2 analysts who are working with the code. And this year we added an additional analyst to the team. And in the process of doing that, we had a new set of eyes on the code, and it was discovered.
Got it. And just a few more questions, and then I want to hand it back because I know we have a lot to do. I think you guys mentioned this, but the city is not funding cooling centers. They are basically working with partners that are funded, and they're in charge of their needs there. Is that correct?
Yeah, there's no funding. We take our existing staff to administer the program, and we have built really strong partnerships with the libraries, with the older adult centers, with, other community groups, the Salvation Army, other places like that. And so we are really grateful for the partnership of those organizations, but there is no funding, no line item for any city agency or nonprofit to run these centers.
Got it. And right now, how many are 24/7 during a heat crisis?
No cooling centers are 24/7. The
And-
website is 24/7.
Website, got it. And what are the normal hours for most of them?
They're whatever the normal hours are for the facility, based on, and I think people probably understand, the hottest part of the day and when we have heat emergencies, unless it's something really out of the ordinary, which has happened from time to time, and we have adjusted. But usually as the sun starts to go down, we are out of the heat emergency around 7, 8 o'clock, and then it can start up again the next morning. And as Carrie said, most people, you need to get out of the heat for a few hours. This isn't like a coastal storm or something where you're at risk, obviously, for the whole time. You need relief for a few hours. So we do, if we have extreme heat where the heat indices gets above 100, we will talk to city partners to see if they can extend their hours. But I think, as we all know, the nonprofits that run senior centers, libraries, these are not, generously always funded organizations. And so they are super responsive. They work really closely with us, but we try not to put too many demands on them as they are not being funded.
Yeah, got it. The last question here. What is like the minimum standard to be one? And are there things that you need to have? Like, do you need to have access to public bathrooms? Do you need, obviously, I would imagine you need central air conditioning or some other cooling mechanism, but like, what is the criteria to actually be eligible for one?
Sure. Again, we keep it pretty low because we want to encourage different types of organizations to be a cooling center. You need to be open to the public, to the entire public, not to just a specific population. You have to have air conditioning. It doesn't need to be 65. I think it has to be, in the range of the mid-70s. You need access to seating and access to water, and you have to be able to have a contact that is willing to work with our staff, because sometimes, we do have warning that heat's coming, but if we're on the margins, it can change over the weekend. It can change on a holiday. Like I said, last year we were activated on Juneteenth. We were activated several Sundays, and not all organizations, run 24/7 like our organizations. And we prefer, obviously, that they are accessible. About 90% of cooling centers are accessible, since they are mostly adult older adult centers and libraries, but not all of them are. So, we work with them. There are, once people have air conditioning, we can probably work through the other things if they really would like to be a cooling center.
Got it. Thank you. Thanks to the chair.
Sure, thank you, Councilmember. I just want to mention that we've been joined by Councilmember Ariola. How many heat emergency days did New York City experience in 2024, and how does this compare to previous years?
So last year, we were activated for 23 days. Sometimes that was between June and August. Sometimes it was one day. We did have a long heat activation, which I think was about 5 or 6 days. The average is usually 2 to 3. The year before, we were activated for 5 days. So it's not, just like we might have a rainy spring, or we might have more hurricanes one year than another, or more snow, less snow. It's not like we can predict. We are seeing over time, generally, obviously, that things are becoming hotter. But usually, the least we've had is about 5, and the most we've had is 24.
Okay, what trends are being seen due to climate change, and what can New Yorkers expect to see regarding the timing and length of heat waves in the coming years? And as a supplement to that question, given that the federal government is looking to pull apart the National Weather Service on some level, what mechanism do we have to make sure that we are aware of what weather is coming to New York?
Our number one partner that we work with is the National Weather Service. We had calls with them last week based on some flooding concerns. So we are, still working closely with them. I can't speak to what would happen if we start to lose more specific federal partners like the Weather Service. It would really hamper our ability to forecast. We also work with we have a smaller contract with a private weather forecaster that we use, from time to time as we need them. But, the NOAA and the National Weather Service cannot be replaced for city and state governments with, some private contractors.
In terms of, I know this is not a budget hearing, but in terms of the private contractors, and if we need to go that route, we do have executive budget hearings coming up in May, so I'm just putting it out there to be something to think about in terms of letting the council know what might be needed.
I'll just say, Councilwoman Ariola knows because we had our budget hearing a few weeks ago. New York City Emergency Management is more than 50% federally grant funded. 2/3 of our staff are federally grant funded through Homeland Security and FEMA. So if some of the predictions come, that have been laid out come true, we're going to have much bigger issues than maybe weather forecasting.
Okay. What guidance does the administration provide to New Yorkers to help prepare for extreme heat events, and where can this guidance be found? I know you mentioned the website. Is there anything else, or you want to talk about?
We do extensive work to educate New Yorkers in advance of extreme heat events, and then of course during extreme heat events. So the health department has a lot of information on our website. Our heat mortality report is there. We have great information for New Yorkers about how to stay safe, and a huge part of our push is also to help people get access to residential cooling if they don't already have that. So the Home Energy Assistance Program is the primary way for individuals to get access to an air conditioner. And so every year, right about this time, we send out a health advisory to all of the providers in New York City, healthcare providers, and letting them know, reminding them the heat is coming. If you have a patient who may not have cooling at home, please get them signed up for this program as soon as possible, or help them find this program. The last actually I think it's 3 years now, at least the last 2 years, that program has closed in July because they ran out of funding. This is a federally funded, state administered program. And every year, the administration, the health department, emergency management, colleagues at the mayor's office we submit a letter to the Office of Temporary and Disability Assistance, which administers the program, advocating for additional funds to be allocated to that program, specifically for the summer cooling assistance, and also for utility benefits. So, you know, it's one thing to have an air conditioner, but if you can't afford to turn it on, it's a problem. Right. So we continue to advocate for that, and again, as we're all kind of sounding the drumbeat, we know that there are federal changes. The Home Energy Assistance Program in particular is one of the ones that has been reported as cut, and so we need to continue to advocate for these funds for New Yorkers who need it.
Do you know if all the if we ran out of air conditioners last year?
Yeah, so last year the program closed in mid-July, so they no longer had funding to provide.
And one of the questions that I was thinking about when both of you were testifying is, because it is true that if people have air conditioning, they're not going to go to a cooling center, right? So, is there a way to figure out where people have the least amount of air conditioners in terms of the aging population and people with disabilities and all of that? So that maybe we have more cooling centers in a particular place than somewhere else. Like for example, you know, the district that I have is mostly, not all, mostly upper middle class. So there may be less of a need there than someplace else. So I'm just curious as to whether or not that data is available.
I'll say a couple things. There is the heat vulnerability index, which not always, but generally will coincide with lower income neighborhoods, which you know, may have more vulnerability overall. And so we definitely, I think a scale of a 4 or 5 are the ones that where it really can be a serious issue, and so we do focus on those areas. We also, you know, we've received outreach from council members and others, and so depending on different populations when things may be open, we have worked with them. You know, some areas are more isolated than others, so we're well aware of you know, where our cooling centers are located, where some may be you know, and sometimes it's also not socioeconomic. It can also be if you're in Northeast Queens, if you're in Staten Island, public transportation is much more limited.
Right.
And people also may not be isolated in a social sense, but they may not live in, you know, apartment buildings. They may live in homes where someone isn't checking on them every day. So there are many different, with heat, sure. There are many different vulnerabilities, things that we're looking at. We work with visiting nurse and with other meal providers, especially over long weekends, times when we know, you know, that there could be a heat emergency. So we're looking at all these different vulnerabilities. And again, we appreciate all the outreach that the council does, you know, along with us to bring this to the forefront.
So what campaigns or initiatives has the administration conducted to help educate New Yorkers on the health risks of extreme heat?
So as Carrie said, they do a lot of outreach. We also have done a lot. One thing we focused on the last couple of years is outdoor workers, you know, delivery workers, people. We've distributed cool kits, cooling towels, other water things, because, you know, as she said, the more time you spend outside and the level of your activity, that can also put you at risk. So that is a population that we have focused on. We, I'm proud to say that emergency management, 100% of our advertising last year went to ethnic and local media. And so we have done a lot of advertising around, we do, our 3 that we focus on are heat, Notify NYC, and coastal storms, evacuation routes. And so we did a lot of messaging in many different languages in very hyper-local papers. And also people may come from another country where they're used to heat. And so maybe they think, you know, that they can handle it. And then things, you know, I think by the time you start realizing that you're ill, you know, it may be too late to get the help that you need. So we focus very locally on heat and other advertising.
Do you do any collaboration, like with the Parks Department, to make, because where there are more trees, the temperature seems to be lower because you have the asphalt and all that creates heat. So is there any, in terms of planting trees or whatever, collaboration there?
Yeah, if you look, so the overall website, the Cool It website and the cool options, we do put things like if there are pools, I don't know if we get to the level of, shadier areas, but we do talk about splash pads, about other things that may be available if somebody doesn't want to go to a library, but they want to visit a park or something like that. We're also working with C40. The city got a grant to work with some nonprofits to set up misting stations. So like if you've ever been to an amusement park or something like that, you may go by where the cool mist goes on you and you get immediate relief. So we and other partners are working with some nonprofits to set some of those up in some of the more vulnerable neighborhoods that you've mentioned as a pilot project.
What factors are used to measure the HVI in communities?
Yeah, I'll take that one. So our heat vulnerability index is designed to look at community level heat health impacts, and includes both environmental, like green space, as well as social, like access to air conditioning indicators. There's a total of 5 indicators. That also includes surface temperature, poverty, access to air conditioning, and green space and race. And so together they provide us with the ability to understand at a community level where we want to be prioritizing and where people have the greatest risk at, again, a population level for those heat health impacts.
How often is the heat vulnerability index updated?
Yeah, we update it. So those 5 indicators are all ones that are relatively slow to change, and they're the data are not easy to collect. So what we do is we update the analysis when there's new data available for all 5 indicators, and the last time we did that was in 2023. It's included in our heat mortality report, and we can definitely send that to you if you'd like more information.
Which neighborhoods currently have a 5 HVI rating, which is the highest risk?
I don't have that directly in front of me, but
Can you get that to us?
But we can definitely get that to you. It's also available online, and we have maps as well, and we have an interactive heat vulnerability index tool that allows people to type in their zip code, and then they can see what the indicators is and each of those individual ones as well. So we'll make sure to send you all that information.
Have you been seeing a trend in the HVI risk?
Yeah, so the HVI is designed as point in time, so it's not designed for trend analyses, but we do have trend analyses, and the best way for us to look at that is with our heat mortality data. And so I can share with you that when we look at trends in heat exacerbated deaths, we see that there was a great decline between the early 1970s to 2000, and that directly is associated with the increase in residential air conditioning that we know happened during that period. And then more recently, we have started to see an increase, which we know reflects the growing number of hot days and extreme heat days that we're seeing in our city, and we've now plateaued out at about, as mentioned earlier, about 500, more than 500 deaths each year.
Can you walk us through the process of activating the heat emergency plan, just like step by step?
Sure.
Thanks.
So we, our watch command is, our eyes and our ears, they're 24/7. So they are monitoring National Weather Service forecasts, continuously. And once they start to see, it could be as much as 5 to 6 days out. Once they start to see that we might get close to hitting the triggers, which I think Carrie mentioned, are a heat indice of 95 degrees or higher for 2 or more days, or a heat indice of 100 degrees for any amount of time. Once they see that we might be hitting those triggers, they will talk to our on-call team. They'll talk to me, to the commissioner, and we'll start to monitor internally to see if there's any confidence, if we think it's really going to get to that level. We will also, our human services unit will start to reach out to our partners, because as we said, many of them, they're nonprofits, they may have smaller staff, they may not be open every day, and so we try to give them, they have let us know over the years that they would much rather get an early heads up, and then it turns out we don't have to activate. Which is better than on a Sunday calling them and saying, oh, the forecast has changed, can you all open tomorrow morning? So we will be very proactive with them. We will also start messaging to the public, not to scare anyone, but just so people are aware, so they can start to make plans, maybe start to look in on people that might be more vulnerable. We'll definitely give a heads up to elected officials, to our nonprofit and other partners. Once we get within a few days and we can see that we have confidence that we probably will be in a heat emergency, we set up an interagency heat call. That can have upwards of 100 people on it, all city partners, nonprofit, the library systems, all of them, and then we'll have state partners, regional partners, and we'll go through, make sure that people understand, is it going to be extreme heat? Is it going to be regular heat emergency, or is it going to be something where we're going to look for extended hours, or that? Are we hitting a federal holiday? There's Memorial Day, there's Juneteenth, July 4th, Labor Day. These are all holidays where we could have a heat emergency. Is it going to go over a weekend, which can be more challenging? I will say Wednesdays are the best day for a heat emergency. Almost every facility is open on Wednesday. But we can't, we don't get that lucky. And so then, what we also do is once we know that we're moving towards a heat emergency, we're working on the messaging. Our GIS unit is also looking, because do we have to update the map? Is anybody offline because their air conditioning broke, because they have construction, they have something else going on. And so we will do that. We usually will have a press conference. We'll have the health department, aging, city hall, so we can let people know. And then we'll continue to monitor throughout the heat emergency. We send our citywide incidents coordinators kind of as secret shoppers. I know elected officials do too. Gail Brewer's staff loves to do that. But to go into the sites and to see, is it open? Is there signage? They all have signage in 14 languages. But sometimes there can be a little error, and so we want people to find them. We want them to use the locations, and then at the end of every day we get a census, so we'll see are people going to them. One thing we haven't talked about is people will not go to a cooling center if they have to leave their pet at home, because it can be dangerous for cats, for dogs. And so a couple years ago we opened up a partnership with Petco. So they are on our cooling center map now. They are well utilized. I go to the Petco in College Point to check out, to see how things are going. And so that's another thing that we will advertise. We don't want anyone staying home, putting themselves at risk, because they don't want to lose their dog. They don't want to leave their dog at home. And so that is kind of the overall. We'll do a report at the end. We'll deactivate the cooling center finder, and we'll get ready for the next one.
Are there any projections in terms of the heat emergency for 2025, or not yet? I mean, there's no long range.
No. We do a preseason call. We also do a preseason call with the council, as I'm sure you're both aware. Those will be coming later in May. But, we, being emergency managers, we plan for the worst. So we look at, what if we had 25 days? What if we had 30 days? And we definitely look to holidays, to Saturdays, to Sundays, to days that we know are more challenging.
Has any thought been given to using hospitals? Sometimes they have auditoriums and things like that.
Sometimes when we've had an extreme heat emergency, we have talked to them about, if there is our facilities. I will also say, if there is, just because we have a heat emergency doesn't mean we don't have fires, we don't have water main breaks,
right.
Hurricanes,
Understood.
all the things that can happen. But we will also bring out, we'll work with the MTA, just like we bring warming buses to sites in the winter. We can also bring buses that can be used as cooling buses. So if you had an incident in your district at a specific building and people had to be out, we would also work to get cooling buses there for that point in time. But again, we're always looking for new partners, new people that we can put on the map that people can avail themselves of.
Is there anything that should be included in the heat emergency plan that's not currently mandated by Local Law 85 of 2020?
We don't think so. I mean, we've laid everything out. Like I said, I think when this bill was first drafted, the website was not 24/7. Technology has caught up and we're able to make it 24/7 now, which I think is hopefully helpful for your offices when you're advertising that a heat emergency is coming. It can be helpful for the public. And so we feel that, everything that needs to be there for the cooling center to run as efficiently as possible is already codified.
Is there any kind of hotline or any way that somebody can locate someone if a cooling center is supposed to be open and it's not? Or in terms of locating a cooling center?
So for elected officials, as always, you can use the InterGov email, and many people do. People can call 311, if they reach out. Sometimes they reach out to reporters and they get to us, but definitely if a member of the public, if the hours are wrong or something, the most efficient is to call 311. Our representatives are on all the calls that we have, and they will route any information. Because once we get that information that a cooling center isn't open or the air conditioning's broken or something, again, we don't manage those sites. So then we will have to, figure out, okay, that's this older adult center and work with aging and their contractor, or we'll work with the library. So it is a multi-pronged step. Also, if we get reports like that, we'll send out our citywide incident coordinators to make sure that it wasn't just a blip and see if there's any emergency needs that site needs right at that moment.
Have any of the recommendations in the New York City Comptroller's report on cooling centers been adopted?
So the site is 24/7 now, the website, which I think was one of the best things that we could do. We also have looked to expand. Like I said, last year we added some elected offices, we've added cultural locations, and we continue to talk to other partners to see what other spaces can be added.
According to the 2022 report, Queens had the lowest number of cooling centers per 100,000 residents. What steps has the city taken to increase the number of cooling centers in Queens, and how many are intended to open during the next heat emergency plan activation?
We're right now working with our partners to see how many locations will be open this year. Like I said, last year we started the season with 620 potential, and many days we had many more than 500 set up. Looking at other locations, I think I mentioned before, the city of Chicago for the entire city opens up 6 centers. There's no,
Is that right?
There's no city, no jurisdiction to our knowledge that opens up anything remotely close to what we do. But we understand that people want to stay close to home, and so if you have ideas, you're both from Queens, if there are other places that you think could be helpful, let us know, and we will reach out to them and see if they want to join the program.
We have a casino soon, you can do that. I said Queens. So what I want to ask you, other cities, do you know what they do in, aside from cooling centers aside, do you know what they do in heat emergencies? Because particularly places like LA and other places, I'm just curious.
It depends. I would say that places like LA, we work with Houston, Harris County, Miami. People, and Carrie knows more about the science, but their triggers I think are higher than ours just because they have so many hotter days. I think they have much more air conditioning saturation there, because I don't think you want to live in one of those cities, and not have air conditioning. So it's a little bit apples and oranges, but we have looked, especially during COVID. You both were active during COVID. In the summer of 2020, there was the Get Cool program that emergency management oversaw with many partners. And the city was able to install 74,000 air conditioners for low-income seniors' apartments. So, some of those are still in effect. And so, there are different things that they do, but our program is by far the most comprehensive.
If somebody is an older adult or has mobility issues, is there any kind of transportation program or service to get them to a cooling center?
I think some people already have relationship with Access-a-Ride and things. What we have done is when we've had extreme heat, like if we have 3 or 4 days over, I think the summer of 2019,
Right.
there were really, really hot days. there were partnerships with some of the rideshare programs that gave vouchers to people to use that for transportation, especially in areas that don't have strong, as frequent public transportation.
Some city council offices have had challenges in the past with a lack of communication from NICEM as to when the cooling centers are open and where the nearest open cooling centers are located. So you're proactively reaching out, you'll proactively reach out to council members and all that, I mean.
Yeah, for sure. I think also, again, making the website 24/7.
Oh, yeah, which it was
that
last
has really helped. You know, and I think, look, New Yorkers are smart. They generally know how to find out, you know, if they want to go to a library, they want to go to an older adult center, they know what the hours are, but people can also call 311. And, you know, emergency management, especially our InterGov team, and Commissioner Iscol and I work very hard to be very responsive. So if there are any communication challenges, we can address those.
You spoke about Councilmember Brewer, so the Office of Investigation, her Committee on Investigations went out and audited a bunch of centers and all that. You've made the corrections there, I guess, in terms of the signage and all of that. And do you have QR codes there, or you just have text on the signage?
I don't think we have QR codes on our. Again, we don't receive funding for this program, so when we do update the materials and everything, we'll see if we could put a QR code on that. We definitely have QR codes on our advertising and things, which will push people to the Cool Options site and to the cooling
Pretty
finder.
easy, yeah. And then you can
Take
do
that
that in
back.
other languages too, which I've done with stuff, so.
We do, our cooling center, all of that information is available in 14 languages, just like Notify NYC.
How many cooling centers are temporarily closed as a percentage of all available cooling centers on average every year?
On average, about 90% are open and 10% will be having, you know,
Problems.
some kind of incident.
Okay, so public access to water has been an issue at library cooling centers. Has any work been done to coordinate that and make water available to people at the libraries?
If a library or something is having specific issues, they could reach out. Okay. When you sign up to be in cooling center, part of what you promise is that you will have water available. But if there are some specific issues that we can help with, we're happy to see those through.
California, Washington, and Arizona, and Oregon all have clean air center initiatives. Clean air centers are areas with air filtration systems or portable air cleaners and provide safe places to go during wildfire, smoke, and other air pollution events similar to cooling centers. Has the city considered this as an option, and the bill aside, in light of the increase in air pollution and wildfire smoke in New York?
You want to start?
So I'll start just by talking from sort of a public evidence base for public health. So we definitely are always looking at ways that we can protect New Yorkers' health and protect folks and reduce their exposure to air quality or poor air quality. But I really want to draw a distinction between what we know about heat emergencies and what we know about air quality emergencies. So for heat, we have this acute risk, right? We have data that show us very clearly as the temperature rises, we see that increase in illness and in death. We have hundreds of deaths every summer. But for air quality, we're more concerned about chronic exposures, and there isn't the same type of exponential risk for these short-term exposures. And so what we've always leaned on and what we have really worked on with the city, with emergency management and others, is developing clear messaging around reducing your time outdoors, and if you're outdoors, reduce the intensity of your activity and potentially wear a mask if that's appropriate for you. And so opening a clean air center here for the very few circumstances, I mean, we're all thinking about 2023, right? We're here, was very, very frightening, but the idea of opening a clean air center, we don't want to be introducing a potential increase in risk for individuals from leaving an indoor environment, which by definition is going to be better than that air outside, and travel, which we know all New York, right? We're all going to have to go outside, we have to take a walk to the subway, whatever it is. And so that's our concern, and what we're really focused on is leaning into the evidence base, providing clear messaging to New Yorkers in an air quality emergency around reducing their time outdoors. And then for heat emergencies, we lean into cooling centers because that is a proven evidence-based way to support an emergency response as part of our larger response.
During the COVID-19 pandemic, certain older adult centers throughout the city, as well as public schools, were outfitted with air filtration systems. Do these air filtration systems also operate to filter out particulate matter from wildfire smoke?
So there's a number of different types of filtration systems that can be put into a variety of different places. Most, air filters are designed to do some level of filtration for specifically for fine particulate matter. I can't speak specifically to the ones that were installed in the schools, et cetera. I don't know the details of that, but we could check on that if you're interested.
Do you know, Christina, or no?
I don't. I know they have put a lot of things in. We focus mostly on the generators in schools, and outfitting them for coastal storms, for power outages, for things like that, looking at an all hazards approach. But they have done a lot of work in this area.
Yeah, because the reason I'm asking is whether or not they could be used as clean air centers if they do have the filtration. So maybe that's something to look at.
I appreciate the thought. I think one thing that I will just re-emphasize is, regardless of our knowledge of the quality of the air in a particular center or school or whatever, we still have this issue that we don't know the quality of the place where somebody is at home, and they have to leave their home and go outside, which is going to increase their exposure to get to that location.
What agency or agencies would be, you've already talked about the issues about the cooling center program, but what agency or agencies would be best equipped if we did this?
I think, we would have to look at, like Carrie said, do more research, talk to some of our partners on the West Coast. The difference being that they unfortunately experience wildfires and things at a much larger rate than we do, so this is something that they may have to turn on more often. I think outside of some of the challenges that Carrie said, one thing that we fear is, as we've said, these cooling centers are really an unfunded mandate, right? That our partners have stepped up, and I can't, I can't amplify enough how fantastic the libraries have been, the older adult centers, the community centers, all these places. But, to put more requirements on them, air conditioning is not getting cheaper. We all know how much, energy and other things cost. And so to put another mandate on them and to start to say, because, there aren't hundreds of community locations that we're not aware of, right? You all know your districts, health department knows, we know. And so it would really be going back to the same partners, putting more requirements on them, at a very large cost, with money that the city probably, wants to spend on other programs. And then again, we don't. So we have, when that all happened in June of 2023, we quickly made masks available at many locations. Mm-hmm. We have seen very low demand for that. And so we don't see that these sites would be utilized.
Okay. I'm done with my questioning. I'm gonna ask Councilmember Narcisse. She has some questions.
Thank you, Chair. Thank you for being here. Like I see, home air conditioning is very, very important for those folks that don't have them. Like I used to say to my staff when I used to have a DME, so diapers and chalks may not be important to you, but for the person that actually need it, it can be very, very important. But in this situation, home air conditioning can be a life and death situation for some. So, from my understanding, that you rather, which I'm in agreement, what you said, you rather the focus should be for people to stay indoors, especially when the AQI increase, right? And even in the heat, when it's really hot, you rather the person stay in their home air conditioning instead, right? So in that, if it's that case, why don't we try our very best to increase the amount, especially when it comes to seniors, to have the air conditioning at home? What are you doing to make sure that can happen in order to have people in the room, on the street trying to get a place? Are we doing any projects together?
Specifically projects around expanding home air conditioning is what you're interested in. Yeah, we are very much. So the health department has been working for some time with our partners, specifically on trying to increase the resources that are available for the Home Energy Assistance Program. So this is the benefit program that will buy a person and install an air conditioner in their home. And over the last 4 to 5 years, we've done tremendous outreach and increased the uptake of that program here in New York City. It's a statewide program and it's federally funded. However, it needs more funding dedicated to it. So in the last 2 years, the program has closed early. The Summer Assistance Program has closed early because they've run out of dollars, right? They don't have any more funds. And so part of what we've done is really done a lot of advocacy with the state to encourage additional funds be put toward that program. And we also want to see that program expanded to also include utility costs because, as you know, you can have that air conditioner, but if you can't afford to turn it on, it's not helping you, right? Yeah. So this is really has been our focus to try to help expand access to home air conditioning.
And please give some focus around NYCHA houses as well, because a lot of folks is not getting the information you get from promote that. Now, quickly, I want to know how many cooling centers that we have around our city.
Last year, we had 622 locations that registered as a cooling center.
How many that we have in each borough? When we talk Brooklyn, for example.
Each one has well over 100. It's not the same. It's not, I don't have the numbers by borough, but it's hundreds in each borough, over 100 each borough.
Okay. About 100 something?
Well, it's 620 across the city, and then divided up. We are working right now with our partners to see what locations will be available this year, and then it'll be broken down by borough.
For the elected officials, are we talking about New York City elected officials, or are we talking about across the board that can be a cooling center?
Anybody. We reached out last year to all of the elected offices. And so there were 4 council members. There were also some assembly members and state senators. We talked to the borough presidents. So, houses of worship can be a cooling center. Any space that's available to the public that has access to air conditioning, has some seating and water. Those are the bare bones standards of what we need.
Okay, so the listing that we're talking about is including those partners, like the elected officials and all that?
The
to have that
620 was all of the partners from last year. There
And
were
what-
about 7 elected officials altogether, I think.
Okay. One of my biggest concern is the fact that elected officials' office, most of them are not open on the weekend. And if they have a heat wave or AQI increase, there is no place for them to go.
Right, so that's why on we list, if you go on the cooling center finder today, it will show you the locations. It'll say that we're not in a heat emergency. It'll tell you to check back. If say June 23rd of this year becomes a heat emergency, we will activate the website in advance, and then you can click. If your office was a cooling center, you would click on it and it would say it's open 9 to 5, Monday through Friday. If the heat emergency went into Saturday, it would then show that your office is closed. So we always tell people to check ahead, because like my branch library, I know Thursdays it doesn't open till 12, but it's open till 8. It's open Saturday 10 to 5. Sundays it's not open. So every location has different hours. So people, there is a little work you have to do to make sure that the site is open.
I appreciate it. That's where I go back to trying to get the smartest way out of it, trying to get individuals, especially the seniors, if they can have just having a home air conditioning, that would be ideal approach right now, because we're talking about how expensive it is for us to do the air testing quality and all that. So now by starting, I think that's one of the area we should be pushing for. So thank you, Chair. Thank you so much.
Sure.
I'm moving back and forth. I'm sorry that I'm just sitting in one place because I have two hearings. I
A lot
apologize.
going on today. Yeah, I just want to acknowledge we've been joined by Councilmember Feliz. Councilmember Ariello, you have any questions? Do you have any questions, Councilmember? No? All right, so thank you. Thank you very much for your testimony. We appreciate it.
Thank you.
Thank you.
Okay, and now open the hearing for public testimony. I want to remind members of the public that this is a government proceeding and that decorum shall be observed at all times. As such, members of the public shall remain silent at all times. The witness table is reserved for people who wish to testify. No video recording or photography is allowed from the witness table. Further, members of the public may not present audio or video recordings as testimony, but may submit transcripts of such recordings to the Sergeant-at-Arms for inclusion in the hearing record. If you wish to speak at today's hearing, please fill out an appearance card with the Sergeant-at-Arms and wait to be recognized. When recognized, you will have 2 minutes to speak on Introduction 998 and Resolution 822. If you have a written statement or additional written testimony you wish to submit for the record, please provide a copy of that testimony to the Sergeant-at-Arms. You may also email written testimony to testimony@council.nyc.gov. Within 72 hours of this hearing, audio and video recordings will not be accepted. Okay, the first, is this the panel? Okay, first panel is, you're gonna have to help me with this. Kanakal is the last name? Okay, so come up and have a seat. Shelby Luster. Racer Garden Lucerna. And Gina Copperstone. Okay, just know that you have 2 minutes for each of your testimonies. After 2 minutes, if you can't, I'll ask you to summarize, and then you could submit written testimony to us in a longer form. So, do you want to start? Make sure the mic is on. Yeah.
Can you hear me? Okay, great. Good morning, Chair Schulman and members of the City Council. My name is Shrivanti Kanekar. I'm the Senior Resiliency Planner at the New York City Environmental Justice Alliance. And we are a membership network of 13 grassroots organizations from low-income neighborhoods and communities of color, and we work with them in their struggle for environmental justice. I'm testifying here today alongside member organizations from NEJA in support of Intro 998 with necessary amendments. An increasing number of New Yorkers are experiencing the negative impacts of our changing climate, especially the impacts of heat, which is a silent killer. As we've heard from DOHMH today, the number of heat-related deaths that occurred annually was corrected from 350 to 580 New Yorkers. And with the highest burdens among Black New Yorkers, who are twice as likely to die from heat-related impacts as white New Yorkers. And these are alarming figures. The city must appropriately adapt its policy management and response to heat as a climate threat. It's critical to ensure that there are sufficient publicly available cooling options to help all New Yorkers. We acknowledge that the existing cooling center program does play a life-saving role for many, but there are also many shortcomings. For example, from an informal survey that we conducted in some of our member districts a few years ago, we found that some cooling centers didn't have working ACs, didn't have extended hours, and some staff did not know that they were actually designated cooling centers. And I say all this to emphasize the importance of clear guidelines and dedicated resources for the program. At a minimum, we'd like Intro 998 to ensure a minimum number of cooling centers that operate across the city, to ensure that there's a subset that work over the 9 to 5 regular working hours, that they have clear guidelines and minimum working standards, and that they ensure risk information is available all throughout the year and to the top 10 spoken languages. We also want the city to evaluate key statistics, utilize.
Just summarize.
Okay,
and then
great. I
we
will
can-
summarize. In conclusion, we are supportive of Intro 998. With the right amendments, we know that this can be a good bill that will support and save a lot of New Yorkers' lives.
Thank you. Next.
Thank you, Chair Schulman and New York City Council members for providing time to testify today. My name is China Copperstone, and I work at We Stay Nos Quedamos. It's a community development corporation in the South Bronx. We Stay Nos Quedamos joins our partners within the New York City Environmental Justice Alliance to request that introduction number 998 be amended to incorporate the recommendations we share today to center the lives of community members most vulnerable to extreme heat-related impacts. Cooling centers are an essential part of urban infrastructure to protect people from the risks of extreme heat days, and our organization is proud of New York City for investing in a program that is meant to ameliorate the threat of extreme weather. However, the current cooling center resources are insufficiently accessible and inadequately equitable from alleviating environmental justice areas from the increased harms of climate and structural exacerbated extreme heat events. The limited availability of cooling centers, both in terms of locations and hourly operations, leaves our most vulnerable populations at significant risk of heat-related illness and death. Our organization represents the voices of underserved neighborhoods in the South Bronx that are disproportionately impacted by heat-related health risks due to lack of community green spaces and access to waterfronts, proximity to pollution sources such as highways, distribution centers, and peaker plants, as well as financial barriers to healthcare and owning household cooling units. The New York City Department of Health 2024 New York City heat-related mortality report reports that, and I quote, "Heat contributes to the deaths of about 580 New Yorkers on average each year during the warm season of May through September. Inequities by race and income persist in the people in neighborhoods most impacted." End quote. 580 deaths from high temperatures is outrageous and it's preventable. Our organization recommends that there are a minimum number of cooling centers located across communities, especially those with high concentrations of low-income residents, a high heat vulnerability index, and in areas with poor air quality and high pollution. This includes the most vulnerable neighborhoods across New York City where environmental burdens are highest. Centers must be easily accessible, I'll wrap it up, by public transit and ideally located within walking distance of each neighborhood. Additionally, we support that cooling centers be operated beyond regular business hours, including evenings, weekends, and overnight, and additionally on those days of poor air quality. These operations should be inclusive and accessible to all and equipped to provide the public with health information.
Summarize.
Sure. Awareness of cooling centers should also be improved through proactive outreach in multilingual languages. And additionally, we recommend that there is safeguarded funding for these cooling centers to be improved for services in order to maintain that functioning that we heard about earlier today. Thank you for your time.
Next.
Good morning, council members. My name is Shelby Lester, and I'm the resiliency planner at Uprose. Uprose is Brooklyn's oldest Latino community-based organization, serving Sunset Park since 1966 and working at the intersection of racial and climate justice. The Sunset Park neighborhood in Brooklyn is a frontline working-class environmental justice community of over 130,000 with a population of over 80% people of color. Sunset Park's industrial infrastructure and limited green spaces contribute to heat retention in the neighborhood, making it particularly susceptible to high ambient heat levels. Waterfront districts such as ours often experience temperatures that are 6 to 8 degrees higher than the citywide average. Extreme heat is the deadliest natural disaster worldwide, claiming the lives of around 580 New Yorkers each year and disproportionately impacting the health of environmental justice communities. According to the New York City Panel on Climate Change, the frequency and intensity of heat waves in New York City will only continue to rise as climate change worsens, making cooling centers a critical lifeline. In my work at Uprose, my primary focus has been filling in the gaps in the city's current cooling center program by establishing our own safe havens in the community spaces around our neighborhood. Our community has made it clear that the city's current cooling center program is inadequate to address the immediate threat of extreme heat. The program does not actively engage with the communities it serves, leading to lack of awareness and trust. We recommend that this bill establish a minimum number of cooling centers in the city with clear operational standards set by the New York City Office of Emergency Management, particularly focused on environmental justice communities that experience high heat index scores. Cooling centers in environmental justice communities should be hyper-accessible and operate beyond the typical 9 to 5 hours. They should provide real-time information about heat-related health impacts in cooling center operations in the top 10 most spoken languages in the city throughout the year. We urge City Council to pass legislation that addresses the lethal outcomes of our city's most devastating natural disaster and prioritize the safety and health of our communities, especially those that are disproportionately burdened by extreme heat and in climate injustice. Thank you for your time.
Thank you. Next.
Hello? Okay. Good morning, Chair Shulman and members of the committee. My name is Raisa Garden Lucerna. I'm the Environmental Justice Manager at El Puente. Founded in 1982, El Puente is a human rights organization located in Brooklyn and Puerto Rico, dedicated to holistic youth and community development through arts for social and environmental justice. I'm testifying on behalf of El Puente in support of the intent behind Intro 998. However, there are amendments needed for it to have the greatest impact. With the Level 4 Heat Vulnerability Index in Williamsburg and Bushwick, we know it's caused by the lack of trees and green open spaces and air pollution from truck routes and high-traffic roadways. Climate change will only exacerbate these issues from Brooklyn to the Bronx. That is why Intro 998 should not only mandate a minimum number of cooling centers to operate across the city, but place an emphasis on EJ communities and neighborhoods with an HVI of 4 and 5. We need greater accessibility for communities to know and utilize these services too. Many of our members are working class, migrant, and recently arrived families who may not have access to adequate cooling at home or in shelters. Urban heat island effect causes heat to linger into the night, and restricting cooling centers to operate during typical working hours neglects these populations. Thus, Intro 998 needs to expand cooling center operation beyond the 9 to 5 schedule. Additionally, Intro 998 should prioritize making information on cooling centers and heat risks readily available with lifetime updates in the top 10 spoken languages of the city. Furthermore, 3 of our NYCHA Cornerstone centers are cooling centers. However, they are not well equipped nor funded to optimally operate and serve the community. Intro 998 must include clear guidelines for minimum working standards for cooling centers' functionality from the New York City Office of Emergency Management and dedicate funding to support operations and maintenance for designated sites. Finally, Intro 998 has the opportunity to directly address extreme heat risk in communities. It won't be perfect at first, but that is why Intro 998 must also consider the submission of annual reports outlining data analysis and metrics to identify areas of improvement to meet the growing risks of extreme heat emergencies. Ultimately, El Puente is supportive of the goals of Intro 998. Heat affects us all, but we all experience it differently, and we believe with the aforementioned amendments, Intro 998 can truly serve all New Yorkers, especially those most heat vulnerable. Thank you for the opportunity to testify
Thank
today.
you all very much for testifying. Appreciate it. In the next panel, Jorge Andres Ramirez. Ariana Osorio. Anita Kwok. And Deontay Johnson. Okay, should I call the names again or just? Okay, go ahead.
Good morning, Chair Shulman and members of the council. My name is Ariana Osorio, and I'm the Resiliency Coordinator at The Point CDC. Founded in 1994, The Point is dedicated to youth development and cultural economic revitalization in Hunts Point and in the South Bronx. Our approach through the lens of art and education is what enables our community to understand what it means to live in an environmental justice neighborhood. Aside from being an environmental justice community, Hunts Point is home to the largest food distribution center in the Western Hemisphere, which makes living conditions in our neighborhood and the massive infrastructure that's here even worse when it comes to the heat vulnerability index. At times, the reported temperature within the city is actually 4 to 5 degrees higher because of PM 2.5 and because Hunts Point is a heat basin. I'm here today to voice the Point's support for the intent of Intro 988. We want to ensure that the city government appropriately adapts its policy, management, and response to heat as a climate threat. Since before the pandemic, the Point has participated in extensive heat research and collection of air quality and temperature data for the purpose of understanding the impact that rising climate has on our quality of life. However, as shared in the New York City Heat-Related Mortality Report, summers are only getting hotter, and our preparedness for such climate emergencies cannot keep pace that safety demands. A strong case is represented by a project we led with the help of NEJA in summer of 2023 called Camp EJ, where our organization led community members in an air quality and temperature study in efforts to understand our neighborhood climate landscape. While the results of our efforts are shown in NEJA's Heat-Related Risks, Air Pollution, and Social Vulnerability report, what you do not see is the physical impact of the site monitoring and what it had on our members who are outside during those extreme heat conditions. Young people from ages 16 to staff members and volunteers ranging from ages 30 to 50 years were physically and mentally affected by extreme levels of heat trapped in the air, as well as the temperatures that were much higher than reported borough-wide.
So just summarize, go ahead.
In summary, we support this, and we support this bill, but one of the things that is missing and that we would like to amend is the communication on a citywide level. We believe that bureaucratic agencies do not do enough work, I guess, like even with the MTA and transit, to let people know that this is a serious matter, that climate change is real, and we would propose that the same efforts that were put out for COVID-19, masks up, that kind of graphics, we need that kind of backing by Link NYC, MTA, any kind of local advertisement in our neighborhoods.
Okay, thank you. Next.
Thank you, Chair Schulman, for convening today's hearing on Intro 998. My name is Anita Kwok, a policy analyst representing United Neighborhood Houses, a policy advocacy organization representing settlement houses in New York. Our members operate senior centers, youth centers, and community centers, which serves as cooling centers. These sites are vital as part of our city's emergency response, and as climate change accelerates, the likelihood of more frequent and intense heat waves increases, and the city must have a plan to keep people safe, especially those who are at risk of medical conditions such as older adults. UNH supports Intro 998, but while the bill sets strong expectations, the city must also ensure that the organizations are supported in meeting these expectations. As one of our members bluntly puts it, cooling centers are critical, but we do not like being a cooling center. There's poor interagency communication that makes operating a cooling center frustrating. Our members work with multiple agencies like NYC Aging, DYCD, DOHMH, NYCHA, and NYSEM, and are often told conflicting things about responsibilities and procedures. We recommend a designated cooling czar to coordinate citywide operations, serve as a single point of contact, and ensure all agencies and nonprofits receive clear and unified guidance. We also have staffing concerns because cooling centers often need to be open outside of regular hours, including weekends, but no additional staffing support or pay is provided. And we urge the city to fairly compensate nonprofit workers through time and a half or stipends, and provide a pool of city workers to support staff to help staff cooling centers. There's also a concern on the lack of funding and reimbursements for CBOs that operate cooling centers. Sites receive no funding for snacks or activities. People will leave a cooling center if there's nothing to do. Computers, TVs, and similar devices aren't standard amenities. And though they may be available at select sites, we urge the city to implement a policy of providing reimbursements to nonprofits for meals and activities at their cooling centers. In addition, we urge the city to invest more capital funds to repair HVAC systems. These recommendations will not only increase the utility of cooling centers, but they'll also save lives. Please see my testimony for more. Thank you.
Thank you very much.
Hi, my name is Deontay Johnson. I'm the policy fellow at the New York League of Conservation Voters. NYLCV is a statewide environmental advocacy organization representing over 30,000 members in New York City. Thank you, Chair Schulman, and the members of the Committee on Health for the opportunity to comment. NYLCV strongly supports Intro 998 of 2024, sponsored by Councilmember Powers. New York City is especially prone to extreme heat, which is the deadliest weather-related hazard in the United States. It has the greatest number of people exposed to the urban heat island effect due to the vast amount of asphalt, buildings, and other infrastructure that absorb and re-emit the sun's heat. Extreme heat events particularly hit seniors, low income, and communities of color the hardest due to structural racism such as residential redlining. While mitigating extreme heat requires multiple solutions, one way to do so is increasing access and funding to the city's cooling center program in an equitable manner. This program helps New Yorkers who might not have access to air conditioner or cannot afford increases in their utility bills to take refuge in public spaces such as community centers, libraries, and senior centers during extreme heat events. Intro 998 is vital because in the past, the cooling center program has been found to be inequitably administered. For example, a previous study by the comptroller, which was mentioned earlier today, found that heat-vulnerable neighborhoods in central Brooklyn, central Queens, and parts of the Bronx had the fewest per capita cooling centers. While we support this bill, we also recommend the bill language consider the following edits. 1. Using the latest available data when establishing the number of cooling centers of legislative mandates, instead of a number based on data from 2017. 2. There should be a minimum number of cooling centers operating beyond regular working days and hours in neighborhoods with high heat vulnerability index scores. As we have seen that hot nighttime temperatures is the same as hot daytime temperatures, there's no difference. So the cooling centers availability should reflect that. 3, the cooling center website should be available in the top 10 spoken languages in New York City. The website should include real-time updates on locations, hours, and services provided. And lastly, and most importantly, if passed, we urge the administration and City Council to allocate sufficient long-term funding to ensure the city's cooling center program is effectively carried out. This includes funding for staff, extended operating hours if necessary, programmatic needs, and more. We look forward to working with City Council administration and advocates to ensure New York City is well prepared for climate and public health emergencies for all New Yorkers, but especially our most vulnerable. Thank you for the opportunity to comment.
I want to thank this panel. Thank you very much for your testimony. And if you have longer testimony, we have yours. We have both of yours, so you can always submit. But thank you very much. We really appreciate the work that you do. Okay, next panel, Sophia Milazzo, Rex Ty, Caleb Smith, and Liz McMillan. Which way do you want to start? You go first.
Hi, my name is Caleb Smith. Good morning, Committee Chair Lynn Schulman and the Committee on Health. I'm the Resiliency Coordinator at We Act for Environmental Justice. I'm glad to be here today with We Act members. We Act is a membership-based organization headquartered in Harlem, serving all northern Manhattan. Our mission is to build healthy communities by empowering residents to engage in the creation of sound and fair environmental policy. I am here alongside our members to uplift this critical emergency program to better support safety and health equity in the face of deadly heat events. The Cooling Center program is an essential safety net for households that do not have air conditioner or cannot afford to run one. Cooling Center visits result in an, estimated 66% reduction in the risk of heat attributable deaths. However, the program is in many ways ad hoc. It has no dedicated budget, little consistency in services and hours, and some neighborhoods lack a location within a 5-minute walking distance. Residents also report limited wayfinding, signage, or advertisements. Community members have told us how to remedy these issues in We Act's Cooling Center audit released in 2020. The passage of this bill will ease the allocation of resources to increase awareness of the program and address barriers to access highlighted by the audit. This bill also prioritizes equity in the quantity and siting of cooling center locations to better serve the most vulnerable populations. Proven best practices for the program, such as extending hours of operations, coordinating outreach with local transit authorities, consistent program reporting, and establishing feedback mechanisms for cooling center patrons can be implemented here. If cooling centers are codified and properly funded, we will be a more heat-resilient city. We Act for Environmental Justice strongly urges the New York City Council to enact Introduction 998, and we will be providing written testimony with more detailed recommendations. Thank you.
Thank you. Next.
Hello, my name is Elizabeth McMillan. I'm a member of We Act for Environmental Justice, and I live in City Council District 9. I want to thank the committee chair, Schulman, for hearing my testimony in support for equitable climate policy. The Cooling Center program is a critical safety net for low-income New Yorkers during extreme heat events. The last 2 years recorded the hottest global temperatures in history. Extreme heat events are becoming hotter, longer, and more frequent. And with so many New Yorkers struggling to pay utility bills, the Cooling Center program is an essential part of the solution for our most vulnerable population. In my neighborhood, the Cooling Center program needs more support because extreme heat events are increasing in frequency, severity, and duration in New York City. Cities such as New York are seeing more severe extreme heat events than surrounding areas, not only due to climate change, but because of the contribution of the urban heat island effect, in which cities experience much hotter temperatures than surrounding suburban or rural areas due to the prominence of closely placed buildings that radiate heat. High vehicle traffic, concentrated building emissions, and less heat-absorbing vegetation. The New York City Panel on Climate Change, NPCC, 2019 report found that the number of hot days has and will continue to increase in frequency, duration, and severities. Introduction 998 will significantly improve the accessibility and use of cooling centers in my neighborhood, providing a much-needed refuge for those who are most at risk from extreme heat. That is why I strongly urge the City Council to pass the legislation. We also hope that the City Council will prioritize the Cooling Center program with adequate funding. The objectives laid out in this bill can only be realized if the city reinforces climate disaster response goals and financial support. Thank you for your consideration.
Thank you. Next.
Hello, my name is Sophia Milazzo, and I am here with We Act for Environmental Justice. I live in City Council District 39, and I work in pediatric environmental health at Mount Sinai, which is located in City Council District 8 and serves New Yorkers from all districts. Thank you to Committee Chair Shulman for hearing my testimony in support of equitable climate policy. The Cooling Center program is a critical safety net for low-income New Yorkers during extreme heat events. New York's climate impact assessments climate projections for New York City show some of the state's largest increases in extreme heat. New York City has historically experienced an average of 4 days per year over 95 degrees Fahrenheit, but this number is projected to increase to as high as 32 days per year by mid-century, which is over a month each year of dangerously hot days. And it's expected to increase to almost 2 full months per year by the end of the century. Cooling centers are a vital community resource on these extreme heat days. Extreme heat causes direct and indirect health effects that span acute illness and chronic health issues. These health effects are more likely to affect our most vulnerable community members. Children are a particularly high-risk group. As someone who works with a team of pediatricians, I cannot overstate how important it is for families with children and low-income families of color to have options for cool, safe, convenient spaces if they don't have adequate AC where they stay. It's a life-saving health measure. Intro 998 would significantly improve the accessibility and use of cooling centers across the city, providing a much-needed refuge for those who are most at risk from extreme heat. I strongly urge the City Council to pass this legislation. We also hope that the City Council prioritize the Cooling Center program with adequate funding. The objectives laid out in this bill can only be realized if the city reinforces its climate disaster response goals with financial support. Thank you for your time.
Thank you. Next.
Good morning. My name is Rex Tai. I am a resident of Central Harlem in City Council District 9, a member of We Act for Environmental Justice, and a physician working in New York City Health and Hospitals. I want to make the case for addressing heat-related death and illness through crucial steps like improve access to cooling centers is overwhelming and indisputable. Very recently, a wide swath of professional medical societies have adopted position statements to study and prepare for climate-related health effects with the utmost urgency. Leading health journals like the Journal of the American Medical Association and the New England Journal of Medicine have all issued advisory reports for how physicians and public health officials should address and advocate around climate health and heat specifically. Heat has multi-system health impacts, and a lot of attention is given to the acute health consequences such as heat exhaustion, heat stroke, but I also want to bring attention to the statistically significant increase in chronic illness exacerbations that come from heat as well. This includes allergic triggers for asthma attacks, increased risk of cardiovascular disease like heart attacks, preterm birth, developmental delay, the list goes on and on. Again, it's a whole system, whole body set of health consequences. In the post-pandemic era, with rising healthcare costs, hospital closures, systemic staffing shortages, an inability to proactively and comprehensively prepare for extreme heat will stretch the city's healthcare infrastructure only further. New York City makes political and budgetary decisions about how sick it chooses for its residents to be. Please empower the Department of Health, healthcare workers, and community advocates to serve New Yorkers in the best ways we can. I strongly urge the Council to support this introduction to enable cooling centers to be widely available, accessible, and operated to a high standard. I additionally endorse all of the testimony and recommendations of my environmental justice allies and urge close collaboration in its effective and equitable implementation. Thank you.
Thank you very much. Thank you to all of the work that you do, and thank you for coming to testify today. Okay, next, Amisha Sharp. Before you go, Misha, I just want to, if there's anyone present in the room that has not had the opportunity to testify, please see the Sergeant-at-Arms and fill out a card. All right, Misha, go ahead.
Great. Thank you, Councilmember Schulman and committee members for the opportunity to testify. My name is Misha Sharp, and I'm the Assistant Director of Policy for 32BJ Health Fund. We provide health benefits to over 200,000 32BJ union members and their families using contributions from over 5,000 employers. For many years, we have talked about the rising prices at New York City hospitals, which drive up the cost of health benefits and squeeze workers' wages. For too long, purchasers and patients have been expected to shoulder the burden of skyrocketing hospital prices. New York needs to act immediately to lower commercial hospital prices and to slow those increases over time. Today, we thank Councilmember Schulman for introducing Resolution 822, calling on the New York State Legislature to pass the Fair Pricing Act, being sponsored by Senator Krueger and Assemblymember Jackson. The Fair Pricing Act would lower prices for routine healthcare services so that the same procedure costs the same price regardless of whether that care is delivered in a doctor's office or a hospital outpatient clinic. This legislation would create over $1 billion in savings for New York in 1 year, with over $200 million directly back to New Yorkers by lowering out-of-pocket costs. Safety net and public hospitals are notably exempt from the Fair Pricing Act because these are not the hospitals charging New Yorkers the highest prices. We can't let the fear of the problems faced by struggling safety net hospitals prevent us from taking common sense action to rein in the highest prices that leave our healthcare market vulnerable to profit-seeking behavior. Thank you for your time.
Thank you very much. Really appreciate it. Appreciate you coming here today. All right. We will now move to Zoom testimony. Please wait for your name to be called to testify, and please select unmute when prompted. Isabel Friedman.
Good morning, Chair Schulman and members of the Committee on Health. My name is Isabel Friedman, and I'm an environmental health advocate at the Natural Resources Defense Council. NRDC strongly supports Intro 998, which would codify the city's cooling center program, enabling it to better protect frontline communities. Extreme heat kills more people than all other natural disasters combined, resulting in 350 fatalities in New York City alone each summer. However, the burden of extreme heat falls overwhelmingly on low-income communities, communities of color, and older populations. Cooling centers are an essential tool in combating extreme heat, especially for low-income communities and unhoused individuals who lack access to cooling devices and face higher rates of energy insecurity. In fact, cooling center visits can reduce the risk of heat-related deaths by an estimated 66%. However, the current program lacks consistency across sites, staff trained to identify heat-related illness, and signage to increase public usage. Intro 998 would strengthen this program by ensuring environmental justice communities are prioritized in the quantity and siting of the city's cooling centers, as well as empower the city to better allocate resources to improve utilization of the program. To maximize the bill's effectiveness, we propose the following short additions. First, the responsible agencies should base the number of cooling centers on the most recent data to account for rapidly changing climate risks and update the number annually. Second, a minimum number of cooling centers that operate outside of the 9 to 5 window should be established in each heat-vulnerable neighborhood. Third, and most important, sufficient and dedicated funding must be allocated to this program by the city. With what's likely to be another record-breaking summer quickly approaching, we must act now. On behalf of NRDC and our partners, I urge the city to pass this legislation and allocate funding for these life-saving cooling spaces. Thank you for the opportunity to testify today.
Thank you very much for your testimony. Okay, we will, thank you to everyone who has testified. If there is anyone present in the room or on Zoom that has not had the opportunity to testify, please raise your hand. Seeing no one else, I would like to note, no, yes, no. Okay. Seeing no one else, I would like to note that written testimony, which will be reviewed in full by committee staff, may be submitted for the record up to 72 hours after the close of this hearing by emailing it to testimony@council.nyc.gov. I want to just call one more time Jorge Andres Ramirez. No? Okay. I want to thank everyone. I want to thank everyone who testified today on this very important topic. Climate change is only going to make our heat waves worse, and so we need to make sure that we have our cooling centers and make sure that we have the ability to have places to go for people where the air quality is a problem. So thank you very much to everyone, and with that, I close out today's hearing.